Hi, Rena. My name is Lean. I'm the student clinician. I'm coming in to see Linda for swallowing. We're gonna do some meal observations, I just want to know a little bit about what you noticed yesterday. There were reports in chart history that said her swallowing was difficult. Can you give me a little more detail?
Yeah, so I just noticed she had some swallowing difficulties as I was feeding her. When I was feeding her, she would, have some difficulty swallowing. More specifically, it would take her multiple times to be able to swallow. So she would take multiple swallows. I also noticed that, there would be a noise when she would swallow. And she reported having, some stickiness in her, in the back of her throat.
Okay, some stickiness. Yeah. And did you notice any did she say anything specifically to you when you were feeding her, or were you just continuing?
She would pretty much just, open her mouth to ask for more food.
Okay, perfect. And the sticky sensation, did you notice that she did anything or asked for anything to help her with the stickiness?
No, nothing comes to mind, no.
No, feeding is normal?
Feeding, yeah, just proceeded as normally. Just feed her.
Okay, sounds good. So I'm going to go in, I'm going to assess her a little bit, do the meal observation, and I'll come back and we can speak a little bit more. Okay, hi, Rena, I'm back. So I just finished the meal observation. I noticed that it has been no decline since the last time I assessed Linda. Her pharyngeal swallowing seemed good. Her chewing and management of the food seemed good. She did tell us a little bit about that incident at breakfast, you said. She mentioned that at breakfast, her swallowing was difficult, but it was mostly because of the rate at which she was eating. So she felt that there was a lot of food to manage, and this was different and very difficult for her, and definitely an off day. So overall, her swallowing isn't too concerning. I'm not gonna suggest or recommend an upgrade or downgrade to her diet plan, but I did want to talk to you a little bit about those recommendations that would help her swallow. So I've put up 3 recommendations. They're on an orange paper by her bedside. You'll see that I recommended that she needs about 3 to 4 swallows before you offer her next bite. And before you offer that bite, waiting for a head nod, eye contact, or a breath would be really good before you continue to offer the next bite.
Well, I wouldn't offer her the next bite. She would always open her mouth for the next, to offer, to say she wants more food. So I would never give her more food unless she opened her mouth.
Right. Okay. So I'm hearing that you are feeding her because you notice that she's asking for more, that opening her mouth is asking for more.
She's just asking for more food.
Okay. So today I confirmed that Linda is comfortable indicating she's done with eye contact and a head nod. So when she's opening her mouth, can you confirm if she was actually trying to say something instead?
Well, I assume that opening her mouth meant that she was asking for more food. So if she would open her mouth, I would give her more food. You're telling me that, she was feeding completely normally today?
Today, there were no significant differences in her ability to manage all thickness types. So she's on regular solid, she's on thin liquid, and she managed well, and we don't see any decline. So there is no reason to recommend anything specific related to safety or efficiency. This is kind of about the feeding process, which we know is difficult for Linda. She's only been fed by an assistant for about a month. So it's important at this stage to just emphasize autonomy and help her feel comfortable in this dynamic. So the most important thing right now is addressing the the concern and the fear that if she eats too much, she may choke. So she feels uncomfortable when there's too much spooning into her mouth, and she reports that the rate of feeding is too quick. So in the future, I think just having more dialogue would really benefit Linda. Is that okay? Is that something like that you see possible for the nurses to apply in the future, or for yourself to apply?
Yeah, that's good to know. Thank you. I think those tips will really help us communicate better.
Yeah, for sure. Thank you so much. Okay, I'll see you later.
Okay, bye.